Hi, I'm Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Consultant. Today's video is about the hyperbaric prescription. So I would explain how we write a hyperbaric prescription and what are the components of hyperbaric prescription. As you know, hyperbaric medicine is actually just like any specialty of the medicine like surgery, medicine, ophthalmology, etc. In hyperbaric prescription, as you can see, I would show you, this is my prescription. There are three components. One is the session. The session is actually a 60 minutes of hyperbaric session performed inside the hyperbaric chamber. Actually, it's 60 minutes because it's maintained at a specific pressure. And because of this specific pressure, 60 minutes of treatment is taken, but it's actually not of 60-minute duration. It can be of 90 minutes duration because you add the 15 minutes before for filling up the chamber for compression. And after this session finish, there is another 15 minutes of decompression. So 15 plus 15 is 30, add with the 60 minute becomes a 90 minutes of total affair. But we call it a standard 60 minutes session because in 20 years ago, the International Hyperbaric Associations all decided to keep the hyperbaric session as a 60 minutes session. But some old studies would carry on with 90 minutes, but this is not now the case. Now we are going with a 60 minutes of hyperbaric session. So the first component in the prescription is a hyperbaric session of 60 minutes. The second is of course, the pressure, because hyperbaric environment involves pressure. The pressure can be 1 atmosphere, 2 atmosphere, 3 or 4. We call it absolute atmosphere because we add the atmospheric pressure with it. And the number on the dials can be different. It can be another unit called bar or pascals, or it can be atmosphere. So that's the job of the hyperbaric medicine, to calculate the different units for you. The third thing is the number of sessions. Like I described the sessions, the number of sessions can vary. It can be from 30 to 60 to 90 or sometimes even more than 300. It depends on the nature of the disease. So a hyperbaric medical consultant will actually advise the number of sessions, the pressure, and also the duration of the session, which is standard now. So that's all about the hyperbaric prescription. Now I would explain how we write the hyperbaric prescription. The prescription is written by similar method like the other medical specialist applies in other specialty, that we take the medical history of the patient and he pays for the consult. He or she pays for the consultation. The doctor takes around 1 hour talking with the patient and he forms the medical history. That medical history combined with the investigations which the patients have performed, the medical investigation written by the other doctors or by the hyperbaric doctor, all are taken into account and a decision or a diagnosis is arrived that this person is suffering from this disease. And based on this diagnosis, the prescription is formed. So when a hyperbaric medical consultant is writing a prescription, he takes feedback from other specialties like the surgeon, the medical consultant, also the ENT, ophthalmologist, depending on the nature of disease. So there is actually a feedback taken from the other specialty as well. And when the prescription is written, sometimes the hyperbaric medical consultant can refer you to another specialist, just like it happens in the other specialties. And this is one of the newest specialties of the medicine, and it works in a similar way. Sometimes, for example, I have designed a medical paperwork with like a multiple choice question with choices which can help the doctor to arrive quickly that which condition the patient is suffering, and that's helpful. So I usually design medical documents and things for a hyperbaric facility which would enable the doctor to come to diagnosis quickly. Sometimes these medical documents or everything is also transferred into a computerized information management system. So sometimes it is computerized and it is on the computer or on the website as well. So that is how a hyperbaric medical doctor comes to the final prescription, which will determine how you would take the hyperbaric treatment. I also give the patient an information booklet which contains what clothes to wear, with things you can take inside the chamber and which you can't, and what are the precautions you should be doing while undergoing the hyperbaric treatment. So it is very important and imperative that you take the consultation of the hyperbaric doctor, because if you don't and if you think that just buying the chamber will treat you, you are absolutely wrong, because it's a specialty. There is a textbook for it now, there are reference books, and there are millions of research articles all over the world, and one has to follow the protocol while undergoing treatment in hyperbaric chamber. I hope you understand how the prescription is written now. Thank you very much for listening. Take care. Goodbye.